Welcome, everybody, to the Cone of Shame Veterinary Podcast. I'm your host, Dr. DrAndyRoark. Guys, I am here today with the original anesthesia nerd, the one and only Tasha McNerney, and she is fantastic. As usual, we are talking about the block cat and running effective anesthesia and pain control in those emergency cases. Guys, we see a lot of these in the vet clinic. They are an emergency, and we want to do right by our patients as far as making them as comfortable as possible while we do uncomfortable things to save their life. Gang, let's get into this episode.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. DrAndyRoark.
Welcome to the podcast, the one and only Tasha McNerney. How are you?
I'm good. How are you? How is everything?
Man, things are good. Rolling into the spring. Exciting times around here. Getting close to the summer break. The kids are starting to to make plans for what they're going to do this summer. I got a load of mulch from my garden, and that makes me happy. So,
you know you're an adult when you're excited about mulch, right? And then what type of mulch? Are you a red mulch person? Are you a brown mulch person? Are you a black mulch person?
It's brown mulch,
okay.
Yeah, it's the double brown mulch. Yeah, it is. Yeah, wait, the hummingbirds will be back soon. And that is where I am in my life.
Listen, my husband is, out there feeding the birds every morning, and he's very concerned about the birds. He likes to watch the birds. He likes to tell me how many birds are in the backyard, whether or not there's a chipmunk with the birds, if he saw a rabbit outside. And these are the things that we get excited about now, right? Yeah.
Yeah. You married a cat.
Yeah, I did. I did marry a crazy cat lady, and that's totally fine. I love him. But yeah, he's excited about birds. Choosing a high quality bird seed is very important. And we used to be cool. We used to go out on Saturday nights, and now we're like, so righteous gemstones and researching bird feeder options. Yes, that's a Saturday night.
Yeah. Okay. We need to spend more time together because one, righteous gemstones for the win. I love that. It's a guilty pleasure show. I love that show. And then number two, this was the first time in my life I have ever walked into a Lowe's and looked at the different bird seeds and thought, ugh, who would feed that? I never had a thought like that in my life. I'm like, what has the pandemic done to me? It has made me, I'm like, ooh, this is cheap stuff. I'm not doing this. What have I become? Good God. All right, let's write this. Let's write this shit. Let's talk about other things besides bird seed and righteous gemstone. Let's talk about block cats.
Yeah.
The other part of the trifecta of things that are super cool. All right. I have a case. Tasha, you are, first of all, for those of you who don't know, you are the founder of Veterinary Anesthesia Nerds, which is a Facebook group and also a conference now, and so many things. For anyone who's interested in anesthesia, you should really check out Veterinary Anesthesia Nerds. Where's the best place for people to find information on that group?
So our Facebook group is probably where we are the most active, where we talk about cases every day and run through cases, equipment, etc. We also have a website that you guys can check out. And then we have since partnered with DVM 360. So a lot of our content and articles from the administrators, myself, Steven Sital, Darcy Palmer, all VTSs in anesthesia. We have a lot of articles on DVM 360 that you can find there as well for different anesthesia topics.
That's awesome. All right, cool. I'm going to toss you a softball today because I just want to make sure that I am up on my game. Yeah. It's, I just want to make sure that I'm doing it right. It's one of those questions, like just make sure that nothing has changed in how I'm doing this. Make sure that I've got all the pearls that I need to do a really good job. I have a 4-year-old male neutered domestic shorthair named Hercules Mulligan. And, he is obstructed. He's come in. He was straining in the litter box. His owners, who are huge Hamilton fans, brought him in, and they were like, he's crying. He's in the litter box. I feel his belly. I know immediately what's going on. This guy is obstructed. I've pulled some blood on him. I'm checking my electrolyte levels, making sure that nothing is super wonky there. And he seems to be okay. aside from starting IV fluids, things like that, I need to go ahead and get this cat unblocked. And I don't want this to hurt. And I also want to get him pliable and easy to work with. And so again, he is an otherwise healthy, middle-aged, young to middle-aged male cat. Help me with my anesthesia, analgesia protocol here so that he is comfortable and I can do what I need to do as quickly as possible.
Sure. So first of all, anesthesia, I mean, it's definitely about drugs, but it's not all about drugs. And we know with some of the more kind of progressive ways, at least in the last 10 years, and what I have seen and probably you've seen in practice as well, is that we don't just like go into drugs. We want to take stock of kind of where the patient is at. Kind of like where with their own fear and anxiety. So how scared is this cat,
okay.
right? So how upset is he with being at the vet? How fearful is he? How reactive is he? And that is really going to play a lot into what I do next. If he is very fearful, if he is very fearful and painful, then I'm probably going to go with some IM sedation. I don't want to take this cat that is potentially, again, very fearful, very painful, obviously. If anyone here has ever went on a very, very long car ride and had just a, overextended bladder that's getting very uncomfortable, if you think about that times 10, this is what our patients are experiencing. So very uncomfortable. Yeah. I don't want to take that patient and then have to have our support staff kind of like sit on or muzzle or wrestle with this cat to try to get a catheter into them, an IV catheter into them. Stress is going to be the enemy for these patients. I mean, any cat that potentially has any underlying cardiac issue with, potentially a hyperkalemic patient as this, we don't want to stress them. So stress is our enemy. So let's take stock. If he is a super love bug cat and he's going to let me put an IV catheter in and facilitate that without an IM injection or IM sedation, great. And then we can follow up with some IV analgesics, anesthetics, etc. But if he is saying, no, you guys, I've had enough. I've already had a crap day. I don't feel good. You're not going to twist my arm to put an IV catheter in. No. Then I'm probably going to sedate. And I love this option because just sedate the cat, right? Just give them drugs. We have lots of great drug options that we can give them. And first off, we want to look at our analgesics. Certainly, if you have a pure mu opioid in your practice, my favorite is methadone, but if you guys have hydro, you could consider hydro. Now, just remember, you might see some vomiting with the hydro, but if that's your heaviest hitter, go with that. I like a methadone combination. Again, if you don't have methadone and you're like, oh man, I only have butorphanol, okay. Even though that's more of a sedative than an analgesic, go with that. So we want to combine an analgesic with a sedative. Now, sometimes, as people know, and if they've ever listened to me talk, they know that one of my favorite sedative analgesic combinations is opioid plus dexmedetomidine. This is not the patient I would probably choose for dexmedetomidine because, again, we don't know exactly, unless you've taken blood and evaluated his potassium levels, we don't know where that's at. I don't know if he is hyperkalemic and bradycardic and potentially already having some arrhythmias because of the urethral obstruction. So let's just assume maybe he is, and I just want to be very careful. So I'm going to take dexmedetomidine off the table. In a younger animal, a lot of times, especially if they're already stressed, sometimes I might combine midazolam or benzodiazepine. But in a younger animal that is already stressed, fearful, aggressive, etc., I'm probably not going to utilize midazolam because our benzodiazepines can kind of give them that excitatory reaction, and it's even more pronounced in younger patients. That's why, for a lot of the anesthesiologists that I work with, if an animal is under 3 years old, we're usually not hitting them with a benzodiazepine because it's going to ramp up that excitatory phase. Especially if you have a stressed cat, nothing's going to take them through the roof like a benzodiazepine. So I'm taking that off the table too. So what I'm left with is usually
you're taking away all my favorite things.
I'm sorry. Listen, don't worry. We have other options.
I'm running out of my medicine cabinet's looking kind of thin at this point, Tasha.
So we have other options, and the opioid is going to be kind of your heavy hitter. And if you want to, whatever opioid you decide to use, I would just go a little higher on your dosing. And then if you have AlFACS in your practice, this is where AlFACS can really shine. Because AlFACS can be utilized IV or IM, we will usually combine the AlFACS together with an opioid and then give that IM. So if this is a spicy kitty who we want to be very, very cardiac friendly to, we usually combine opioid plus AlFACS IM, let them sit in a nice calm, quiet environment. And that means don't put them next to a dog that's recovering from surgery and potentially howling. Don't put them next to other cats that could stress them out. If you can, put them as isolated and as quiet an environment as possible while they kind of calm down, let those drugs start simmering and working. Now, once those drugs have taken effect, or while the drugs are taking effect, I should say, that's the time that your staff should be gathering the supplies that are needed to unblock this cat. Now, whether or not you guys like a red rubber or you like a Foley or you like a Tomcat, personal preference, just have a list of things together so that your staff can work quickly. I always advise that I'm a big fan of checklists. I love an anesthesia checklist. I love a surgical checklist. So if you have a little page in your nursing binder that will just say, hey, for urethral obstruction, this is what I want you guys to get out and ready. So that way, while that cat is simmering on its drugs, you know, hey, I'm going to go pull the fluids. I'm going to go pull out the supplies I need for a sacrococygeal block. I'm going to go pull out everything the doctor might need to facilitate this unblocking, make it go as smooth as possible. So use that time while the cat is simmering on its drugs and its analgesics to gather everything. So that way you're not running around and kind of, you know, with a spicy cat and a painful cat, it's always kind of a race against time with them, right? So like, how much can I get done before their stress catecholamines override the drugs I've given them, and then now I have to add in more.
Hey guys, we're going to jump in with a couple of quick announcements. First off, if you have not head over to DrAndyRoark.com recently and signed up for the Dr. Andy Roark newsletter, you're missing out. What's on the podcast is in our newsletters. I like to write letters in our newsletters. We've got some great article stuff that comes out there. It is all really good stuff, and it's totally free right in your inbox. So DrAndyRoark.com, sign up for the newsletter. Also, on May 21st, we have a fan-freaking-tastic workshop over at Uncharted Veterinary Conference. It is virtual workshop. It is called Retain Your Team. Speak the languages of appreciation in your workplace with the one and only Dr. Tracy Sands. Guys, this is at 2 p.m. Eastern Time, 11 a.m. Pacific. It's a 2-hour workshop on May 21st. It is free to Uncharted members. It is $99 to the public. If you are trying to get your staff to stick around, if you're trying to get your staff to be engaged, if you're trying to get your staff to feel like their work matters and you keep buying donuts, but it's just not having the same effect that it used to, it's time to do something different. It's time to learn about the languages of appreciation. We have a self-assessment so you can look and see how you're doing and how you can make changes going forward. Guys, that's how we roll. May 21st, 2 p.m. Eastern, 11 a.m. Pacific time. Head over to unchartedvet.com and click on upcoming events and you'll get all taken care of. Gang, let's get back into this episode. Talk to me a little bit about AlFACS alone IEM. That's not a route that I've used a whole lot. So give me just a general idea of what are common side effects? Like what amount of time are we talking about? Like just help me feel out what to expect when I go this route with say a methadone or a hydromorphone mixed with some AlFACS alone.
Sure. So AlFACS is a pretty great drug, and then we know that we use it as an induction agent. Anesthesia people like to call it propofol 2.0 because it gives you the same effects of propofol. And when I say same effects, it's a great induction agent. AlFACS in itself is a neurosteroid molecule, works on the GABA pathways, and it is going to function similarly to propofol. And when I say that, you also are going to get hypotension the way you would with propofol. If you give it in a big bolus, you also can see apnea the way you do with propofol if you give it in a big bolus. But if we're talking about via the IM route, I like to think of it just kind of like as the cream in that Oreo cookie, bringing the opioid, like smoothing everything out together. Yes, I do use a lot of food references in a lot of my lectures.
I love it.
And kind of like your AlFACS alone with the opioid together kind of makes this nice like combination for the patient, because if we're just relying on all opioid, we know that opioids by themselves are not usually sedating. And the amount of volume or mgs per kg we'd have to give to really sedate a cat that's already painful and spicy is a lot of opioid. And then we could be seeing opioid side effects, right? Bradycardia, et cetera, which we don't want. So if we combine our opioid with an AlFACS alone, AlFACS is water soluble, so a much better option than something like diazepam, which hopefully people are not giving diazepam IM anymore. But you can combine these two things in the same syringe, opioid plus AlFACS, and give that. Usually for cats, we are doing like 1 mg per kg, right? Sometimes 2, but usually 1 mg per kg of AlFACS IM together with your opioid of choice. And you give them about 10 to 15 minutes. And I'm not saying that they are all the way out in the same way that they would be maybe with a dexmedetomidine or ketamine combination. But again, we're trying to avoid those cardioactive drugs in this patient. So they might be out enough that you can facilitate smooth IV catheter placement. And then once you have an IV catheter placed, you could top off with more AlFACS, give them flow by oxygen, put all your monitors on, and then place the sacrococygeal block and get ready to go.
Yeah, cool. Talk to me a little bit about the sacrococygeal block. Just give me some best practices, tips. How do I want to set myself up for success with this?
Oh man, this is one of my favorite blocks to talk about. I like to talk about a lot of blocks, but if anything, the reason I really love sacrococygeal blocks is that you don't have to work in a specialty practice or university. This is something that every general practice, you already have the supplies on your shelf to do this block. And it is going to be a game changer when it comes to urethral obstruction cats. So the nice thing about the sacrococygeal block is it is just 25 gauge, 5/8 inch needle, a 1 cc syringe. You want to keep it as clean as possible. So if you can utilize sterile gloves, that is great. And just some stuff to scrub up the area. And it's kind of, again, dealer's choice with the drug. Some people like to use lidocaine. Some people like to use bupivacaine. I personally, in this patient in particular, will utilize lidocaine, a little more cost effective. And for this particular patient, lidocaine is going to last for a couple of hours. I could utilize bupivacaine and desensitize that area for the 6 hours that bupivacaine could. But for most of these patients, once we relieve the obstruction, a lot of the pain will go away. And the nice thing about utilizing a lidocaine or a sacrococygeal block is it is one of the very few drugs or route of drug administration that's going to completely cut off those signals going to the brain, right? So we know if you guys have ever had local anesthetic at the dentist or et cetera, if you've ever, childbirth and had an epidural, you know that it cuts off those signals going to the brain. So that way, when your doctor flips the cat over or puts the cat's feet forward or however their technique is, once they start trying to extrude that penis, with a sacrococygeal block on board, it's desensitized, and the penis will often just come out of the prepuce. There's no fiddling with it. There's no kind of pulling on it, which causes a lot of irritation and inflammation. So we see a huge reduction in irritation and inflammation, a much faster speed of unblocking, and overall less anesthetic time for the patient. So for us, a sacrococygeal block is very cost effective and very effective when it comes to pain management.
All right, that makes total sense. All right, good. I feel like I'm really set up well for success here. What pitfalls do I need to look out for? Are there things that you see people get wrong? Are there mistakes that people make? Any common trips or traps that I should look out for?
So for blocked cats, sure, right? I think everybody's terrified of tearing the urethra or something worse, which certainly can happen. So I would say that if you are going to do anything, and I've seen a couple not great things happen, and usually it's when people are over aggressive or utilizing. The one I have seen is utilizing a stylet, kind of like a metal stylet, to go inside the red rubber to give it a little more oomph. But the problem is you give it too much oomph and it goes in, and I have seen a urethral tear that way. So just be careful if you're utilizing anything like that. And these cases can be really frustrating. If you feel like you're trying and you're not getting anywhere, and the patient's, the tissue is just getting more inflamed, take a step back, ask a colleague if they want to step in. I think that has been really the biggest thing for me as a technician, since I'm usually monitoring the anesthesia and I'm watching the clinicians do this. If they're getting more frustrated, they're going to put more pressure on that tissue. It's not a great experience for anybody. So if you have a colleague, just say, hey, I am not having any luck with this. Do you think there's a technique? because again, everybody goes to vet school in different places and learns from different people. So I have one doctor who really likes the Tomcat catheters. I have one doctor who really likes the olive tip catheters. So there might be a technique that you haven't learned or you haven't thought of. So instead of keep messing with that tissue, phone a friend, ask somebody to help.
Yeah, a lot of it's not even where you went to vet school. A lot of it's just what kind of day are you having?
Oh,
like that, like that's the classic. Is some days like I just don't have it. Some days, and some days I can throw it across the room and hit exactly where it needs to go. But yeah, I don't even think it's often your training or your style. Just some days it's just not your day, and it's better just accept it and phone a friend before you end up in a hole.
Yeah.
Awesome. Any final pearls, anything like that? Any last words of advice?
No, I guess, I love these cases, and I think a lot of clinicians really love these cases as well, because you can see an immediate, you can see such a difference in 24 hours with these patients.
Super rewarding.
But for technicians, what I tell technicians is use the time that the animal is simmering on its drugs to really get everything together. And don't forget about your calcium gluconate and your insulin. Just always have that ready and available. So when you run that blood work, if you happen to see a potassium of, 10, you're ready to go with some interventions.
Cool. That's so awesome. We talked at the very beginning about anesthesia nerds. Tasha, what are your, do you have favorite anesthesia resources online outside of Anesthesia Nerds?
Oh, yeah. So I think that, pun intended, the Think Anesthesia website is actually a really, really great website, and it offers a lot of free resources. So if you are thinking about getting some CE and you don't have it in your CE budget to actually go to a conference or even sign up for a webinar that may cost money, Think Anesthesia, which was brought about by some of the anesthesiologists at DrAndyRoark, is a really fantastic website. They have webinars and articles on anesthesia recovery, anesthesia induction, anesthesia for rabbits, all kinds of stuff. So that's a really nice resource that I like.
That's awesome. I'll put a link to that in the show notes. Thank you so much for being here. I always appreciate your time.
No problem. Thanks for having me.
And that is our episode. Guys, I hope you enjoyed it. I hope you got something out of it. If you're on the Facebook, consider checking out the Veterinary Anesthesia Nerd group. Those guys are so great. It is awesome to see people who are passionate about a thing sharing their passion. And that is that group. Gang, take care of yourselves. Be well. I'll talk to you soon.